massive tissue in the brain when an acute stroke occurs. The infarct core, which is seen as a diffusion abnormality, is completely dead tissue. This will not respond to a reperfusion therapy. But the perfusion abnormality tells you about the penumbra, which is the tissue at risk. It is ischemic but not infarcted. If a patient has a penumbra, then the patient will benefit from a reperfusion therapy, and the extent of paralysis can be restricted. So, for example, in this patient who had acute right hemiparesis, who came to the casualty about 1.5 hours after an acute stroke, the diffusion weighted images in the first column show you the infarcted core. This is already dead tissue. By offering IV thrombolysis or endovascular clot retrieval, this cannot be retrieved. But the images in the right column, the perfusion, show you a red area of ischemic tissue, which is bigger than the infarcted core. And this can be salvaged if reperfusion is offered. We see that the angiogram shows a block in the MCA. So this patient is worth treating. If you open the MCA, the ischemic tissue can be reperfused. But if there is a diffusion-perfusion map, that means everything is already infarcted and the patient will